All right, if you are still here, you are in for a treat because this last but absolutely not least session is going to be fantastic. I'm going to introduce our first three speakers, and then we're going to have a family panel, and we're going to kick it off. But this first speaker, Andrea Wilkinson, is the Senior Director of Patient Advocacy and Public Policy at Zogenix. And you guys have heard a lot about Zogenix. And when they showed me the data from their LGS Community Impact Survey, I basically said, you need to come and present this to our families. So Andrea graciously agreed, and she's going to speak. And then right after her, we're going to have our very own Karen Groff, who is mom to Dan and vice president of our board and all-around wonderful advocate, former school principal, who's going to talk about home and family issues. I think Dan is 33. If I remember correctly. And then after that, we're going to have remotely our very own Jen Griffin, who's Director of Family Support at the Foundation, who couldn't be here, but will be here online to talk about school and community issues. Then we'll have a family panel right after that. But first, let's welcome Andrea, who's going to give a great talk on community impact.
Thank you. Thank you very much. Can you hear me? Great. And I think there we go. So it's very important to UCB, formerly Zogenix, that we really listen to you. We listen and learn from the subject matter experts, and so I'm grateful for the opportunity to be here. Thank you very much, Tracy, to present what we found. So as full disclosure, Andrea Wilkinson. I am with UCB now, and this information and presentation was collected through a caregiver advisory board where the caregivers were paid back in the fall of 2021. In order to really learn deeply from each of you, we broke the 8 caregivers into groups of 2, very different settings. This way, every member of the team could really respond to each of the questions, and we could truly appreciate what experience you were living. The first group had a higher socioeconomic situation. Their loved ones had a little bit more mobility and a little bit more resource to support them. They were also either married or had a really strong co-parent who really partnered with them to make decisions. The second group was a lower socioeconomic status. They either didn't work at all or were supported from the state, was culturally more diverse, and their children had a different set of experiences, their loved ones. And this was important because of the lack of resource. It was harder in some cases for them to manage their daily life. We wanted to understand immediately, as quickly as we could, something about your loved one that we might not be able to observe if we met you in this room today, that we may not get to experience, or that others who live your daily life may miss. We learned that the loved ones, and that is so apparent here, are silly and funny, that they love music and art, and that they're really snuggly, very sensitive, and have a kind heart. It was really a gift to start the conversation off that way. We wanted to talk about a day in the life. What's it like living with LGS? And as you've spoken of this week, you experience a spectrum of seizures. Not only different seizures at different times of the day, but no one loved one is living with LGS experiences the same kind of day or progression throughout their life. Those seizures impact the intellectual and physical growth of the child. Frequently, you have disruptive behaviors, which sometimes can be more of a daily disruption than even the seizures. And you live with skill regression and progression and regression quite often, that you can make some incredible strides with your child and he or she can learn as an adult, but that in one long seizure or serious seizure, you might lose some of that. Mobility is really a limiting factor, and that can lead to living life in a very different way. Managing the daily life, living with LGS, we learned that routine is so important, that you really protect that routine and try your best to not have anything disrupt it. But inconsistency in that routine is also daily present. That even though that is most important to you, that more than 60% of the time it can be disrupted. This disruption and this trying to live in a routine so that your child has the best experience that day can lead to isolation, because you may not be able to engage in the same way in the community or with family members. And those seizures can really change over time. So once you get what we heard, once you get that routine set, one day you wake up and it can be a totally different experience. And so you're constantly changing what that best routine for the best day for your loved one can be. And some of the more serious seizures can really be disruptive, the ones where you drop. They're all serious, of course, but those where you might have another fallout, an injury, that can be quite challenging. We wanted to understand the logistics. Like, what is, you read the papers, you hear the doctors present, but what's it like to live at home, to really personalize the home and your transportation safety and behavior? No two LGS families we spoke to had the same experience. It really can differ based on your mobility of your child or adult. It can change dramatically based on your income and the kind of support you have. That really makes a difference in how you live each day. Difficulty planning is not a surprise as you live this. Going out isn't something that families told us they do as much as they want to do, because they're really trying to control, especially for families that have a very active child where there's a danger in new places. Transportation can be experienced differently amongst families. So those with less income and less jobs are dependent on public transit. And that's very unpredictable, especially during COVID. And so arranging for a ride to meet a doctor's appointment where you need to plan an hour and a half to get there because you're using public transit when the bus doesn't show is a real problem. But parents also are incredibly inventive. And so they learn all kind of hacks, which is super cool. Families with loved ones who are not experiencing Dravet, who have siblings or even husbands or wives, they really do try to take time for yourself and even for self-care. But it's hard. It's hard when you are living a life of constant disruption. But the intent is there, and that is so powerful. And one thing that I really came to appreciate was that the primary caregiver is always on, never really gets a break, because if it's a school, the school's calling. If it's the physician's calling. If it's the pharmacy, you're always on. You don't really get a chance to stop. There's always somebody who needs you personally. This can lead to an emotional experience of the caregivers, and feeling judged was something you all expressed from these caregivers' perspectives. You all experienced in different ways. Families, feeling judged from your family. Why are you hovering? You need to not be so, helicopter parent. That leads to distance over time because you don't necessarily want to manage that family in the same way. Friends that you had maybe before are different than the friends you have now. Although I look around this room and see you all making friends, it's really incredible. And then even the healthcare team can be judgmental if they may not be the right fit for you. One mom expressed a real disappointment when she took her daughter to the ER, and the emergency responder said, "It's just a seizure. Why are you so hysterical?" They're not going to die from a seizure. So that kind of misinformation out there amongst your family's friends, not enough knowledge around what it's really like to live your experience, can lead to have a big emotional impact. Schools, even if you have a seizure action plan, another mom said, I gave up. They called me every time she had a seizure, even though the seizure plan said, don't call me unless it's been over 5 minutes. So I just finally decided it was too disruptive to have her at school and have to come pick her up every day. Caregivers often react, is what we learned from these 8, to the day-to-day life, rather than knowing, even when we heard the beautiful mother stories who had adult children or older children, even though you know there's some things likely to come, it's hard to plan that far in the future. You really just, what we heard was that you live each day in a very reactive way and you manage it in a routine as best as you can, but that it's hard. Fatigue and overwhelm is quite common. Medicines may really help. We learn, though, that doctors don't have all the answers. In fact, you're the experts. Another mom said, we're the experts of our children, but there's an added layer of responsibility because your life, we understand, is so much more than the seizures that are being treated as symptoms. It's so much more than the behaviors. It requires a lot of logistical management. You're really mini startup CEOs. It's pretty cool to learn from each one of you because you're incredibly innovative. And you fail at something, you move on, you pick it up, you learn, you do something better the next time. It's super cool to watch. Your needs change over time. Once you get a rhythm, when they're really young and you're getting to the diagnosis, there's nobody else like you, is what we heard that you're feeling out there. And then you get into the next phase, that sort of middle school age, and the seizures change and look a different way, or the behaviors start to change. And then you move into that teenage adulthood, where the hormones are changing and affecting your seizures. It's pretty impressive to watch you adapt, again, like a CEO or a chief operating officer, over time as you learn and become an expert with your child and the diagnosis. We asked, what kind of support do you really need? And while there were many answers and many needs from families who live this daily life, what we heard most is that direct support was the most powerful change at home. So being able to get a helmet, being able to get a seizure dog, being able to get equipment that allowed you a little bit of freedom to go to the restroom by yourself, or to maybe be able to take a phone call and deal with managing cares or making appointments. Support for pharmacy care, or again, making those appointments, could be a real game changer for families. Durable medical equipment. As your child grows, they need different chairs along. I've heard a couple of moms talking about that, and dads this week. Education, and you're sitting in this room or on the Zoom today, education can be really important, and you need that. And it's so wonderful to be able to partner with the Lennox-Gastaut Syndrome Foundation to support those kinds of educational needs. Moms and dads make all kinds of adaptations when they don't have the resource. I spoke about you being real innovators, and I'm honored to know you. You really do adapt quickly. We heard mothers speaking of, he really loves to eat. So I want to make sure he gets to keep that as long as possible, but he can't chew. So we blend his food. Or a mom who can't afford, because she doesn't have that kind of income, these amazing beds that are outside. But she ordered a tent, and the tent works. Dad, who figured out after 18 years that an Amazon cot is a great way to change your child while you're moving in a van at a rest stop, because then you're at least 18 inches up. We wanted to listen in different ways, and because when you speak, you say things differently to each of us depending on what our backgrounds are. This information is so powerful. So we asked an artist to take what she heard in this presentation and tell us a little bit about what it looks like in an illustration. And so this illustration, which I won't really walk through, is a summary of what we heard from you. And we felt like a really good way to sort of capture. We spent 5 hours with all 8 This is a way that we could take all that data and turn it into something that translated into the experience and what we heard. We hope that it captures your experience, and there are copies of this pamphlet at the LGS information desk if you find it helpful to share maybe with people who aren't as familiar with your lives. You walk this walk. You talk the talk every day. You are truly experts in your field, in your startup child, in your startup adult. You're living this life every day. We are so honored to be a part of that experience and are grateful that your willingness to share, because together we can all improve in our work, in our daily lives. So thank you so much for being so forthcoming, not only in these 8 caregivers who we're grateful for, but also what you've shared with each of us over the week. We really desire at UCB to be in partnership with you to work on things and co-create or co-design along the way. So thank you so much for the opportunity to be with you here today.